Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, diapers. Mike Shaver is the president and CEO of Brightpoint, a social service agency serving the state of Illinois. He speaks to Dr. Josh Sharfstein about a campaign to help families afford diapers in order to improve health, financial security, and emotional well-being. You will never look at diapers the same way again. Let's listen.
Mike Shaver, thank you so much for joining me on Public Health on Call to talk about diapers. But before we get to diapers, could you tell me a little bit about your organization, Brightpoint?
Yeah, thank you, Josh. I'm happy to be here. I appreciate the opportunity. Brightpoint is a statewide organization headquartered in Chicago. We serve about 30,000 families every year throughout the state, a combination of early childhood programs, behavior health and wellness programs, and child welfare programs.
So how did you start to think about diapers?
We started thinking about diaper insecurity as a problem that we saw direct impact on in the child welfare space. We know that about 90% of the removals and placements in foster care are usually for causes of neglect, not abuse. And we know that most of the root causes of neglect are really rooted in poverty. As we took a closer look at those issues, and we really realized the importance of having regular access to childcare programs, and realized that many families can't take advantage of childcare due to diaper insecurity. We isolated it as a policy issue we really wanted to address at the state because we saw it as an important protection and insulation against child maltreatment.
Now, you used a term that I haven't heard before, diaper insecurity. How do you define diaper insecurity?
We defined diaper insecurity as something that occurs when parents can't afford an adequate supply of diapers to change their child on a regular basis. So according to a recent survey, we know that this is true for about 1 and 2 families, and that's increased. As little as 5 years prior to that, it was only true for 1 and 3 families. And we think the reason that has really grown is because the costs of diapers have soared by 30% since the start of the pandemic, basically.
So it's been a while since my kids were in diapers. What are we talking about? How much does it cost to keep a kid in diapers? What's a pack of diapers these days?
So we find that on average, the cost runs anywhere from $80 a month on the low end to $100. We know that kids can go through as many as 12 diapers a day. Obviously, if you have a sick kid, that number grows substantially. So we're finding as much as 14% of a family's income at or around the poverty level can be tied up just in providing diapers for their children.
That is a lot of money, particularly for people who don't have a lot of money. $1,200 a year is substantial. So talk to me about the consequences.
So we really think about the implications on 3 levels, right? So obviously, Josh, you were just talking about the first level, right? Which is the financial level for the family. Obviously, when you're spending such a large portion of what limited cash you already have on diapers, it creates tough choices: rent and diapers, transportation and diapers, oftentimes for the adults, food and diapers. So there are clearly financial implications that actually can bring other risks for family when they're having to make choices like that. Secondly, we see the health dimension. We'll start with just the health of the infant and toddler. We know that diaper insecurity makes 2 things more likely in infants and toddlers: diaper diaper rashes, as well as urinary tract infections or UTIs. Those two things have extraordinary costs just in the healthcare space, but they can also lead to broader health implications for the youth. And those are the kinds of things that often show up on the radar of child protection. Finally, and this we find to be an important element, particularly as we think about the overall health and well-being of family, there are emotional consequences for the adult caregivers. A caregiver who cannot bring their child to an early learning center because they say, I don't have diapers, many of them turn them away. It erodes at their self-confidence. It also raises fundamental questions about their ability to care for children. And we know that research and studies show that this diaper insecurity issue and the inability to provide adequate care for your child leads to increased levels of depression, stress, and also caregivers often going without because they can't sort of meet this basic need for their children.
Yeah, I am just so struck by how your organization got to diapers through child protection and child welfare. And it really speaks to the fact that the consequences are serious financially, for health, and for emotional well-being. Let's talk about solutions, because I know you have recognized this problem and you're fighting to help families. What's the solution here?
So our solutions we see in really several dimensions. Obviously, we have been advocating for a very direct and effective support, which is simply let's give families a diaper allowance. A lot of folks don't realize the fact that of all the safety net programs, only TANF, cash assistance, that's the only safety net program that would even create the possibility to cover these costs. And obviously, TANF has a lot of other demands on it. So one of the most effective solutions is simply to do what other states have done, including California, is to offer for all TANF eligible families a direct allowance in that $80 to $100 range. Another solution that we have tested and advocated for is to make diapers more available for early learning centers, childcare providers, whether they sort of push through an allowance for families or whether they're actually able to keep a supply of diapers on hand, provide them. The challenge with that, and the reason we think the first bucket solution makes the most sense, is providing the cash to families to allow them the flexibility to go where they need to go, when they need to get those diapers, is often the most effective in just solving against the risks of diaper insecurity. A third potential policy solution, which we're seeing more and more, is with the emphasis of the current administration in pushing states to use Medicaid to address the social determinants of health. We have seen a couple of states, Tennessee most notably, who have put in for Medicaid waivers to allow Medicaid to actually support the purchase of diapers for children under the age of 3. So those are 3 avenues that we think make the most sense and have the potential to have the greatest impact.
Very interesting what you mentioned about Medicaid, because the logic for those waivers is that it actually can save money, right? If you're giving diapers, then you're reducing those rashes, those urinary tract infections, and other complications. And in a sense, you're saying the diapers are going to pay for themselves.
And that is certainly true on the healthcare side. There's also a University of Connecticut study that demonstrated even on the economic side for families that $1 in relief or support for diaper insecurity resulted in $11 of economic relief for the family as a whole. Again, related to things like less likelihood that the family missed work, less likelihood that the family was out dealing with a diaper rash or something like that, that it actually had real economic and financial consequences for low-income families at a surprising proportion. $1 for every $11 that a family could avoid in cost by having diapers.
I'm curious whether any of the solutions involve sending diapers to families directly rather than sort of the various routes that you've talked about so far.
It's an interesting possibility. We know that there have been, in some places, diapers can actually be provided, but only to older children through Medicaid because of incontinence or things like that. And there's a medical condition, which is what makes it allowable without like the Medicaid waiver. And they have been mailing those. I will tell you, in our discussions, this is why there are diaper banks all over the country. One of the things that we really have discovered as we've done this research is that just from a logistics standpoint, the idea that you have a warehouse that can sort of push these out, I think is tough for government to sort of organize and push that out. Now, there's been talk in the state of Illinois, could we get diaper vendors to the table and think creatively about distribution strategies? I certainly think it's something worth exploring, but it would require a lot more time and a lot more planning. And what we're seeing is a growing need with real implications if we don't meet it in the short term.
So you're working in the short term. What's the state of play right now in the state of Illinois, your state, on providing more diapers?
So we had legislation that we were working on here in Illinois to do sort of that second bucket I described, which is to try and make this something that could be distributed, diaper allowance through childcare centers for any family receiving a childcare subsidy, which in our state is about 250 up to 275% of the federal poverty level. We were unable to get that through. It had a cost of between $6 and $7 million, very favorably received, but we ultimately just couldn't get it out of committee. This was a tough budget year for the state of Illinois. I am pleased to report that Governor Pritzker's office early on put a $1 million pilot in the governor's request of the General Assembly, which is going to go to the Illinois Department of Human Services so that we can begin deepening our analysis, run a pilot, see what the effect is, and take another run at this at a future year.
So the diaper work continues. You got a good start in Illinois, and you have focused on a problem that, frankly, a lot of people don't even realize exists.
Yeah, and we have been really encouraged by the response. I was actually just this week in Washington, D.C. at a meeting with the White House, including members of the administration, the Domestic Policy Council, and they were actually talking to the group about their hope that more states would use the flexibility in social determinants of health with Medicaid waivers as a way to pursue this idea. And they highlighted it as one of the policy solutions that the group was bringing to them that we'd like to see more support for, encouragement at the federal level as we sort of continue to battle these problems in our state. So I'm pretty encouraged about the future and the opportunity, because when you see the data, it's a pretty compelling case, and it represents an enormous opportunity to certainly save costs in the long term. But more important than that is the link that you talked about earlier. I think what is less understood is what a profound risk it is that children who are otherwise safe can become caught up in the child welfare system when you don't meet these kinds of basic needs.
Mike Shaver, thank you so much for joining me to talk to me about this issue.
Thank you so much, Josh. I appreciate the opportunity.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production management by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Eliza Rosen. If you have questions or ideas for us, please send us an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.